Welcome to the I Am One podcast, where we talk to perinatal mental health advocates, professionals, and educators supporting the mission of Postpartum Support International. We're not afraid to ask our guests about the hardest parts of pregnancy and postpartum because we know that PSI has tools and resources to help in every situation, and everyone should know about them.
Whether you are among the 1 in 5 moms, 1 in 10 dads, one of many trans or non-binary parents, or you're one professional or advocate committed to helping folks in need, you are also one of us.
I'm your host, Danny Giddens, and I am 1 in 5. I didn't know what to call what I was experiencing after becoming a parent and felt too scared at the time to speak up.
Not anymore. Now she won't stop talking about it. Hi, I'm your co-host, Emily Jankowski. I'm also 1 in 5, and I want you to know that mental health complications are common, but they aren't normal.
There's something powerful in knowing I am one of many. Whether you're already connected to the perinatal mental health world, looking for new ways to support parents and families, or just want to hang out with us in your earbuds, we are so glad that you tuned in.
Of course they want to hang out with us. We're lovely. Seriously, though, the views, thoughts, and opinions expressed on this pod are the speaker's own. Tuning into this podcast is, spoiler alert, not a replacement for therapy, but PSI can help you find a therapist. We could also help you find a psychiatrist, a support group, or Waldo.
Emily, Waldo? Come on! We don't know where Waldo is.
Okay, fine. PSI help seekers can find peer support and resources in their area.
At PSI, we want you to know you are not alone, you are not to blame, and with help, you will be well. On today's episode, we're sitting down with Nancy Goh Kelly, a PSI coordinator in the state of Minnesota, a skilled healthcare strategist and operator, and surprise, surprise, a massive perinatal mental health advocate. We'll chat about how parenthood can inspire career change, about the difference that specialized care can make for parents. I'm looking at you, perinatal mental health-certified advocates and professionals, and about how striking up a conversation with a pelvic floor physical therapist might just be what connects someone to PSI. Be sure to keep an eye out on the I Am One podcast socials because we're going to try out Nancy's best parenting hack and report back. So without any further ado, please sit back, relax, and enjoy this episode with our friend Nancy. Nancy, welcome to the podcast studio. We are really excited to finally be sitting down with you. And I think that it only feels right to share why I just emphasized finally for anybody listening. That's because I don't remember what month it was. Was it last March or sometime last year? We were kind of set to record an episode and then I got an email. Hopefully it's okay to share this. I did not pre-clear this with Nancy. I'm taking a chance right now. We were set to record and I got an email from Nancy saying, would it be possible to reschedule the meeting? I'm actually supposed to have a baby tomorrow. And I was like, oh, for very high maintenance. Oh my gosh. Like,
I literally can't be in 2 places at once.
Sorry, I'm going to be busy.
We were like, yeah, we'll reschedule. So then we got in touch a while later and Nancy had her baby and I'm not going to name any names, but said baby caused some significant sleep deprivation.
As they do.
Yeah, we kind of needed to bump it again.
So rude.
I know. Very, very rude. But anyway, we are a year beyond that right? Wasn't it about a year ago or I don't remember. But all that to say, we were very excited to be sitting down with you and spending a lovely hour of our afternoon together. No children in any of the houses right now. So that's kind of special. And we're here to talk about all the things. So thank you. Thank you for being here.
Yeah, thank you. I'm really excited to finally, as you said, be on the podcast. I was just looking at our emails right before this, Danny. And yeah, you'd reached out to me like a week before my due date, had the baby. I was like, I'll get back to you, once he's like starts sleeping through the night. Reached out to you when he was 10 weeks old because I foolishly thought that he was going to start sleeping through the night at 11 weeks, which is exactly the time that my older daughter did. And I was like, okay, I'll be well rested for this podcast. And I actually reached out to you and canceled. And shortly after that had actually reached my breaking point in that second postpartum experience. I hate to cancel. And I was just I just was not in the right mental state to have, that conversation with you guys. And yeah, like you said, here we are a year later, and the conversation I think we'll have today is going to be completely different than last year. And, it was a really rough year, but I feel like I finally feel ready to talk about it. And I feel like a very different second postpartum experience and learned a ton from it. And so not happy that it happened that way, but excited to be able to just share that story and have a different kind of conversation with you guys today.
Before we dive in to your introduction of yourself, I have a very important question.
Oh.
How did you sleep last night?
Well, it's funny you asked that because I was, admittedly nervous about the podcast. So it took a long time to sleep. I was just thinking about, what I wanted to talk about. But my second woke up at like 5 a.m. He's been consistently sleeping until, like 6 a.m. And so, of course, perfect timing. Decided, nope, mom shouldn't be well rested the night before recording this podcast.
Come on. I think kids have spidey sense about that.
They totally do.
They're like, something's going on. I'd like to be awake for this.
Right.
Perfect timing. Oh, she planned something. Let's ruin it. And yeah, throw a wrench in there, a really big wrench.
Mm-hmm.
Yes.
Ay.
But thanks for asking, Emily.
Yeah. Well, I think let's just dive right in. Nancy, if you don't mind, would you give us a little bit of an introduction to who you are?
Yeah, sounds good. So I'm Nancy Goh Kelly. I now live in Minnesota with my husband and my 2 kids. Professionally, I had worked in healthcare for over a decade. My role was really in building and scaling new programs and tech products to improve care delivery and the provider experience. And so I, worked in healthcare for a really long time. And then once I had my daughter, that experience just really changed me and my perspective of the healthcare system. I was just, really stunned after working in healthcare for so long about all the gaps in the emotional and mental health support that our healthcare system provides to new and pregnant moms. And so just based on that experience, I decided, I wanted to leave that job. At the time, my husband and I were really privileged to be in a place where I could make that decision to leave my career, take a break, be more present for my daughter and myself. But, ever since then, I just can't stop thinking about all the moms and families that have babies that don't have that privilege or that type of support to make that decision. And just, my postpartum experience, even with the first one, was very hard with all of that support and the extra support that I had. So just really moved me to want to do something to really help new moms and make that experience a lot easier and more supported for them. And so been really kind of obsessed about this topic of helping new moms, understanding a little bit more what these gaps in our systems are and, what the solutions are that are there to solve them. And that journey and that path led me to PSI as well, which I know we'll talk about, but I'm just really excited to be able to share more about that.
Cool. Okay. So you have 2 kids. Was that experience of perinatal mental health complications different? What kind of role did it play in your life each time? Compare and contrast.
Yeah, for sure. I know. Contrast being the key word there, right? Oh. No 2 postpartum experiences are the same.
No 2 babies are the same. You're I have blueprints now. I know what to do. And the second baby comes out and is new plan.
Oh, I was so mad when that happened. I thought I had it all figured out. Very rude. Anyway.
Yeah, exactly. So rude.
Go on.
Yeah. Well, it's so funny with, the first, my first baby when she was born 3 years ago, I didn't realize I had anxiety until probably a year later, when I joined PSI. And, funny story about how I learned this is that I was on one of those free PSI trainings about mental health disorders. I was just learning a little bit more about this space. Bertie Meyer was the facilitator. She was kind of running through her slides, talking about the range of mood disorders, anxiety all the way through psychosis. And she was talking about the risk factors and the symptoms. And she said, if you are calling your pediatrician's nurse line every day, you have postpartum anxiety.
And you were like, excuse me.
Rude. I can't believe she just called me out.
Yeah, not every day, but probably every other day is when I called the nurse line. And I actually knew before I got in the call, I had, the nurse line on speed dial. Before I would call with my next question, I was like, oh my God, there were probably 3 nurses on that nurse line. And I was like, You can like edit the name out, but if it's she's going to be like, oh my gosh, it's Nancy Goh again calling with another question. Like, I was not only worried about like the question I had to ask her, but worried about what she was going to think about me for calling again about like another question that was probably so silly and like unnecessary. So, I mean, when Birdie said that, I was like, gosh. And then she ran through the rest of the like the symptoms, and I was like, check, like yes to everything.
Yeah.
My daughter was actually born in December of 2021. So we were like still in the thick of the pandemic. Everyone was still wearing masks. So in a way, I actually think it was a gift for me because I am like such a germaphobe, or just like very conscious about spreading germs and like washing hands and everything. And so like not being able to have visitors in the hospital, or just like not be really scaling down on like the visitors you would have meeting your new baby was actually like really good for me. Just so I didn't have to like explain that or, take those like precautions.
Because otherwise you'd feel compelled to explain why you were like, I don't want everyone and their funny uncle coming to visit, right?
Oh, yeah.
Like, I don't need 35 people through my house every day.
Right.
But in the non-pandemic context, you feel like you would have felt like you had to like justify it, where you were like, pandemic, enough said. Yeah. Sorry.
Exactly. Or just suck it up. And like, I hate to let people down. Like if they're really excited to meet the baby and he's a week old, I'll just I'll just say yes, like invite them over, and then just worry. I mean, this is basically what happened. Worry the entire time. Like, did they wash their hands when they came in? Were they vaccinated? How close are they getting to the baby? I mean, this is literally like what happened. We had family over and they had a bunch of young kids. And like, I was learning then that like, those are the biggest vectors of just viruses and germs.
Can confirm.
Children are dangerous.
Exactly. And I would literally I would feel just kind of like my chest tighten, and just like when I would see them get close, and like, it just took away from the moment and the experience of like, just seeing the joy of them interacting with their new cousin or, like new friend or new neighbor. And it took away from just like the joy of like experiencing and really appreciating that moment. Whereas like just the whole hour they were there, I was just worried about so many things. And so yeah, just all that to say that like I didn't realize I had postpartum anxiety until kind of after when I was sitting in that training and Birdie said that, and I was like, oh gosh, that is me. So yeah. And then the other thing I'll say actually with that first postpartum experience is I do feel like it could have been a lot worse had I not lined up support, or that, for not having like a built-in network of like family and friends around us. So like that number one was super helpful. The fact that like we had family coming over, like not even asking us, but bringing us meals was super helpful. My family lives in New York, but my two sisters and my parents came out multiple times in that first year to help out. So that was just a gift and so helpful. My husband and I both were very lucky. We had paid leave for at least 3 months. I took an extended leave of 2 additional months that were unpaid. My husband had a longer than normal leave. I think it was like 6 weeks, which was awesome. Not, like the 2 weeks of paternity leave. And then the other thing, I had a really good friend recommend to me when I was 7 months pregnant to join a local new mamas group.
Oh, yeah.
Once I, had the baby. And so I joined that group when my baby was like 8 weeks old for a couple of months. We met like for 2 hours on a weekly basis, but it was a group with like 8 other moms. And it was just so awesome to connect with other moms who were going through the same exact thing, venting and just, having the same challenges. We talked about, everything from sharing our postpartum story or birth stories, everything we were going through, just kind of what was stressing us out, just in terms of relationships or like feeding journeys and sleep, all of that. And we had a facilitator that was just awesome in helping us just talk through all of that. But that was just like that social support and like feeling like you weren't alone and not going through that alone was just awesome. So that's something I recommend to like every new mom just to sign up for even before you have the baby. So you have that built in.
100%. Yes. Find some people.
I didn't do that until my oldest was 1. And I could have gone for a little peer support earlier in parenthood.
Right. I know, especially like when you're, those first 3 months, you're learning like a million new skills that like no one has ever taught you before. And like, you've got 50 new pieces of like baby gear that like, you've got manuals.
And you don't know how to work half of it.
I know. The pump, like the breast pump itself was just like, I mean, I could have taken like a class to learn how to, and I still like don't really know how to use it after using it with 2 babies.
There are also millions of books out there to tell us how exactly we should be parenting. And like, it's nice to have people to go, yeah, I didn't read the book this week. Like, am I doing this? Like, I just kept thinking, am I doing this wrong? No. Having peers that you can connect with and just hearing people share about how their day went. Like, sorry, I'm 15 minutes late. We got all packed up, back into the driveway, blowout, had to go back in, and it was like, oh my gosh, me too.
Yeah,
exactly.
There's like so much compassion in that space. And there's no quicker bonding moment than to bond over literal shit like hitting the fan and just like blowouts like happening on Zoom calls, like people understanding. But like that's like the prime environment for like bonding with other people and just learning things. And it's also like learning genius like baby hacks that like are not in the books and like, on Instagram, and having very specific pointed like advice is just awesome.
Yeah.
Yes.
And I think it also like, I don't know if this sounds bad, but I think it does put things into perspective. Like we had in my twin group, a twin mom. And so anytime any of us ever thought that we were going through like really tough stuff, like we would have her, like hear her speak and we're like, oh my gosh, it's just, just to hear her, like what she was going through, it was just like amazing just to see how strong she was and like times that like she wasn't like able to manage it. But like just the fact that like 2 is just way infinitely harder than 1.
As long as you don't do that thing where you're like, okay, but like I should be fine because it's not that bad, right? Like
I know.
Which I think we all do that. Like we all have that moment where we're like, okay, I suppose it could have been harder had insert conditions.
Yeah.
Right?
Yeah. Mm-hmm.
And like twins are, that's double or more, depending on the babies themselves, the amount of work, right?
Yeah.
But it doesn't mean that like it wasn't, that you weren't highly anxious and dealing with a lot too,
Yeah. It's such a good point, Emily. That's actually why I hesited saying that comment, because I don't want people to feel like their experiences or like what they were feeling weren't valid.
Mm-hmm.
I don't admit this to too many people at PSI. And
oh, it's okay. It's just us, Nancy. It's fine.
No one else.
Yeah, like I showed up to the first PSI conference. I think my daughter was probably like 7 or 8 months at the time. And I felt like my story, I was like, gosh, like everyone has like this crazy story and such a traumatic experience. And I like almost felt like I didn't fit in because I didn't have that kind of experience. And so felt like a little bit of guilt from that. And I'm just, but I think to your point, like everyone's experience is so valid. And I'm always like really pushing and encouraging people to share their story because like any mom is going through really tough stuff. Like my point being that I had a lot of built-in support and like that definitely helped reduce some of the anxiety I probably would have felt had I not had that support. And so I think that really is what drives me in this like work I'm doing to advocate on behalf of the moms that don't have that support, just because I know like how much harder it could have been without that.
I like to compare it to glasses. So like if someone has vision that is so bad, I don't think there's such thing as bad vision, but vision that requires a lot of correction, right? Like 2400, right?
Mm-hmm.
You need glasses all the time. The glasses are going to have a tremendous impact because things were significantly more difficult before, right? Couldn't see nothing for nothing.
Yeah.
But if you have 20/50 vision, you are going to get headaches every day. It's going to be hard to see stuff, but you can actually walk through a room and not run into furniture. But it doesn't mean that you don't still also need glasses. Like you need support, you need therapy or like meds or whatever, So it just because your postpartum experience wasn't as bad doesn't mean you don't still deserve glasses, is all I'm saying.
You deserve glasses, Nancy, if you need them. I want them.
Yeah.
Yes.
I'm not trying to force glasses on anybody, but
It's such a good analogy. I actually never heard that analogy before. So I love it, Emily.
Thanks.
But yeah, bringing people up, it's kind of like just bringing people back up to the level playing field. It's like,
Yes.
and that's the other point too, that I think is so important, is like, there should be a certain standard of support. Like a mom throughout her entire postpartum experience should always feel supported, prepared, confident, like empowered in her decisions. And we are not there. We are like so far from that. And so to get her there, we need way more glasses. We need prescriptions. We need the doctors, like the eye doctor offices. Like,
we need people to know that there are glasses.
Yeah, exactly. Yes. Exactly. Know where to find the doctor's office, or that you can get the glasses.
Yes.
Yeah.
Exactly.
So much. I love that analogy. I'm going to use that now.
Cool. Okay, my analogy sidetracked you though, but we were comparing your first postpartum to your second postpartum. But
I have a question.
We have go ahead.
I have a question about the first one though. We're going to time travel back to when Nancy was, she had been in the training and heard Birdie talk about anxiety, and Nancy was like, okay, well, thanks a lot for calling me out, Birdie. What did you do anything after that? Did you like reach out to your doctor, or what did you do with the knowledge that maybe you're experiencing anxiety?
Yeah, I would say like at the time it was pretty well managed, just for, all that support I had. We had that new mamas group. The other support that we had was like a couples counselor. So my husband and I had actually established a relationship with one even before we got married, because we were like, we need a therapist or a couples counselor that we can just go to anytime. I know we're very like prevention focused in our house here, but like before things turn into like a major fight or crisis, like we wanted to just work with someone for a couple sessions to build the foundation for being better communicators, or like building that relationship off of like understanding and communication. It's definitely not perfect, but we had to start somewhere. And like, we just wanted to do that research, get it out of the way, and like have her available in case like things like really kind of like blew up or bubbled up to access her in the future. But I just mentioned the couples counselor because that was probably another major source of stress and like worry for me. Just like the built up resentment for when you see your husband leave the house for more than like 3 or 4 hours in like a row.
Must be nice not to be lactating.
Yeah, exactly. Feeding, pumping, like not having to worry about feeding your child and keeping him alive. Like, seeing him like work out, or just like, go to the gym, work out, when like he didn't have to recover from like a major tear, like during childbirth, or just like a hard childbirth experience. So that I think was really helpful. Like, I think we had done that work even before I joined that training. So I'll just say like at that year mark, it was much better just because of just like the support we got through that new mamas group, and then also the couples counselor. And then I actually think at the same time, I was not working with a therapist at the time, but I was working with a life coach. And so I was working with her shortly after I left my job, originally, just to have her help in like figuring out what I wanted to do next in my career. And it just became so much bigger than that. It was like this very deep self-exploration, like reflection journey. And so in a way that was like my therapy. And so I was very grateful to have someone I could talk to on a weekly basis to just process a lot of these emotions. It was like half therapy with her, and then the other half was really like focusing a little bit more about what drives me, like what are my values, just reconnecting with them. Mm-hmm. And that's another resource I recommend to so many new moms, because you go through such a life change. You are completely changing identities, becoming a new mom, all of a sudden responsible for not only raising a child, but like just keeping this baby alive for the first 3 months. Mm-hmm. And all of that depends on you, especially if you're breastfeeding. And so there's all that pressure, but making sense of that. And then, for moms who are out there who are working, you're also just trying to transition back to work and like being a good worker and a productive employee. And like, not surprising that there is all this like shame and guilt for moms when they go back to work and they have to send their baby off to daycare with like new providers that they've never met before, that new moms are just completely overwhelmed and like on this path to burnout. So it's just all to say that just working with a life coach was just really helpful to talk to someone to just process all of that. Have someone tell me that like it is, yes, it's very hard. And remind me again, like what brought me joy, because you lose so much of yourself in that experience as well. Because you are trying to take care of the baby, like making sure your husband's like okay with everything. And, everyone around you, taking care of people who want to visit and making sure that their feelings are not hurt.
Yes.
That support was really helpful. It's a long-winded way, Emily, just to answer your question. I do feel like I was very lucky to have a lot of that support kind of like lined up. I did not reach like luckily a breaking point in that first postpartum experience.
So how was the second one?
Yeah, exactly. Tell us more.
Keyword breaking point.
Yes. So you had a baby.
Yeah.
And you were treading water and someone threw another baby at you. How'd that go?
I know. Well, first of all, I have to say, going into the second experience, I was like very intentional. I was like part of the PSI community, like learned so much about perinatal mental health disorders. Like I know we'll talk about my work in a little bit, but really educated myself about like the support systems and like what the symptoms are and like how to recognize them. So going into the second one, I'm like, okay, I'm really prepared. I have to give a shout out to Melissa Bentley, Joshua Mays, Stacy Fig from the local coordinator program. They were like texting me and messaging me. They were like just giving me all this love and support. They were like, take as much time as you need, like reach out if you need any help. So I was like, okay, I've got like the community here at PSI. These are all like therapists who are qualified and trained in this area. And so the first, 2-3 months, again, Danny, up until the time I reached out to you, were just going really well. Like I knew what to expect. And I breastfed for the first journey and then did the same for the second. I actually made a key decision not to put so much pressure on myself and exclusively breastfeed. And so I started formula, like combo feeding with formula from day one. That helps a lot. Yeah.
Second kid, I was like, this one can have formula and it's going to be fine.
I know. But I still had the guilt. Like the second time around, I was just like, but can I still like increase the amount of like times I'm actually breastfeeding him? Like, can I try to do that versus 50-50? Like, even after everything I did just to like educate myself about that, I still felt guilty, about not being able to exclusively breastfeed. But anyway, so around the time I reached out to you, Danny, I was like, okay, the next big milestone is my second is going to sleep through the night.
Yes.
Yeah. And then it literally was just, he did not, spoiler alert. It took him probably 3 additional months to finally sleep through the night. But it just like kind of I like spiraled. I had canceled with you, Danny. And then I was just so obsessed with sleep. And I have to say, I was listening to your podcast with like some previous guests, and one of them was describing OCD. And I almost, this is like another birdie moment, but for postpartum.
You were like, symptoms of OCD.
Yeah. I was like, I probably was borderline OCD because I was tracking every single nap and feed and the time that my baby went down, to sleep. And then when he got up, was just obsessive about that. My husband was like, I was doing all the nighttime feeds and just getting up with my son. And my husband's like, why don't you let me take the monitor? You get a good night's rest. And I'm like, I would just refuse his help because I felt like I established such a like rigid routine that he would like mess it up. And like, we could not get off of that path because I was like really so focused on getting my baby to sleep. And then I was much more short than I normally am. And we had a toddler in the mix at the time. And so
and you're like, put on your shoes, right? Like,
I was like, please put the shoes on. Yeah. And it was just crazy. And I just like, did not like the person I was becoming. And like, the other thing too, is I would, I have a Garmin, it's kind of like a Fitbit. And so every morning, the first thing I would do is just pull up my sleep stats, see how many hours of sleep and like deep sleep I would get.
Yes. Let's analyze the data. I mean,
I know.
Yeah, it's kind of fun, but
yeah, this is where it's like the for not great for anxious personalities because you don't trust like your instincts, but at the same time, very helpful in telling a story. And so I can share more about that later. But I mean, I would just look at how many hours I would sleep and that would just dictate how I'd feel the rest of the day. Like I wouldn't even listen to myself and my body. I would just say, okay, my watch said I had 3 hours of sleep last night. That means I definitely have to get at least an hour nap during the day. And I would like think about when I was going to get that hour. And if I didn't, I would just get really mad and just take it out on everyone else around me. So that postpartum rage was like a completely different level than it was for that first experience. So The point where I like reached my breaking point was I just noticed that like these occurrences of me just like really spiraling or just, being short with my husband and my daughter. There was a week where we were hosting some friends, and by the time they left, I was just exhausted because we were hosting. I wanted to be there for them. I was supposed to have like go on a walk with a really good friend, and I was just exhausted. My husband's like, "Why didn't you cancel on her?" And like I was saying before, like I hate canceling on people. And I was like, "You're right, I have to do it." And I like called her and I just like sobbed. I was like, "I just can't do this anymore. I'm just exhausted. I'm so sorry." But like, I just knew at that point, like I had to start working with a therapist again. And I mentioned that I've worked with a life coach before, but I've also worked with a therapist. So I like know that therapy works. I'd worked with one previously, even before kids, but I was like, this is a good time now to reach out to a therapist.
Mm-hmm. Yeah.
I had to find a new one. And I think having this knowledge working at PSI, knowing that there are differences in therapists that have specialized knowledge in helping new and pregnant moms was really helpful. So
especially if you have anxiety or OCD or depression and the things that feel the most significantly difficult relate to that pregnancy, trying to get pregnant, having a baby, post-loss, whatever it is, like you need someone who is trained in that, to your point. Yeah.
Yep. Trained in that, understands it. I'm trying to remember who told me this, but they were saying like a big difference is like a regular therapist may say, well, if sleep is the problem, just get more sleep. I know you guys talked about this in a previous podcast. Like, I think you said this, Emily, where it's like sleep when the baby's asleep. It's like telling someone to just like do the laundry when the baby's doing laundry. Like,
fold
when is that going to happen?
When the baby folds laundry.
Yeah, exactly.
Okay.
This baby's dead weight and is not folding any laundry. So
I know, exactly. It's just not helpful advice, right? Especially when a mom is like, she's trying to, like in my case, an example.
And babies don't sleep the way that we sleep. Like their increments of sleep are very different than ours are.
Right.
Oh yeah. Right. And especially with someone who has anxiety, like you.
And then you're like, I have to sleep right now.
Yeah. Yeah, exactly. Right. And like all the worrying and just like, it's all that pent up energy, like just prevents you from getting rest.
Mm-hmm.
But yeah, anyway, that's I think when I knew I just wanted to work with a therapist. So I did the research. I pulled up the PSI provider directory.
Okay.
Directory in the house.
I love that resource. And but I like have to say when I pulled it up on my computer screen, it was just like such a surreal moment because working as a local coordinator, like doing that for other new moms, I'm like, wow, I'm like sitting in front of the screen looking for provider recommendations for myself. And it was just very surreal.
Other side of the whole support system there. Like you were coordinating, to help other parents. And now you are the parent that needs to find the support. So
I know, like full circle moment there.
So you pulled up the directory and you were able to find like there were options for folks in your area.
Yeah. I found some options.
Great.
Yeah, in the area. And I have to say, so like, this is why I love like the volunteer work that I do in terms of helping moms do that research. Cause I'm not kidding. I feel like for me, what's really important in finding a therapist is a really good fit. I actually interview a bunch of therapists just to make sure that like there's chemistry. Like I love Melissa Bentley says this, like you always want to make sure that you are in the driver's seat. Like don't just find a therapist that accepts your insurance. Find a therapist that you have a really good connection with because like the more you put into it and the more connection that you have and a comfortable relationship that really with that therapist, like that's really going to help you with just improving or working on what you need to work on. So that kind of like always stuck with me and it's just really important to me. But I'll just say with my story that I probably talked to 7 different therapists. It took a while for me to just find a therapist that accepted my insurance. I found 2 that I really liked, but they didn't have availability until like a month later. And I couldn't wait. Like I needed to talk to someone like within a week.
Yeah.
Melissa, I have to give a shout out to Melissa Bentley. I actually reached out to her because I knew this process of finding a therapist is going to take a long time. So I was like, Melissa, can we like just talk? She's like she's been in this space for so long and she's a therapist herself. And I was like, I just needed to like talk to someone to make them that knows this and like knows the space really well to just make me feel a little bit better about what I'm going through just give me some hope. And so she was so helpful, but she told me just to, not be scared of the diagnosis. I think a lot of people, when they think about therapy for the first time, they think it's just like there's a major problem with them and they don't want to confront or face that problem. But she says that, I think she was saying that she had a client or one of her patients was a grad student and they were diagnosed with OCD. And she said at the end of the day, that quality really helped them get through grad school, with such intense schoolwork and coursework. And so she said that again, don't be scared of the diagnosis. Therapy is really there to help you work through that and understand how to get over those hurdles and the emotions that you're feeling.
And how to work with them so they become not hurdles, but tools. Like that person in grad school, right? Like, can your ADHD or your dyslexia or your anxiety or your OCD be something that you can occasionally lean on as a tool? Yeah. You just have to know how to do that without letting it roll all the way down a hill that you don't want to go down,
Yeah, or completely consume you.
Yes.
Mm-hmm. Exactly. I mean, one example for me too is I feel like for my anxious personality that we were talking about tracking and being obsessive with that. I have to say that I would track everything, the appointments, how many days my kids were out of daycare. And I actually rolled that up into a story and an article that I published around highlighting, to just basically show how hard it is that first year postpartum without support.
Mm-hmm.
It's basically a full-time job. I was able to show that it was 60 hours of work a week between the breastfeeding, diaper changes, sleeping, all of those challenges, 60 hours of work. I think breastfeeding was probably 23 hours of work between the pumping, cleaning the supplies.
Wow. Nancy, you collected the data.
It's information. Yes.
Yeah, exactly. It's information to tell stories. I was that's one way where it does serve me. But to your point, Emily, is it's really important to be able to understand when you are feeling really anxious, honoring that part of you, not trying to suppress it and push it away, but just say, it's okay. Everything's going to be okay. Move on, validate the feeling. It's just practicing that self-compassion that my therapist has taught me so much about. So yeah, that's just a very long-winded way of just saying how, kind of reach that point of really spiraling, but just working with a therapist helps so much, getting me back on track and uncovering a lot of things that I didn't realize were kind of hidden. And I think the reasons for a lot of these outbursts and just kind of these spiraling moments and just unpacking that more.
Thanks for sharing all about that, Nancy. That's great.
Yeah.
You kind of just alluded a little bit to some writing that you've done. And I was wondering if you could tell us a little bit about the ways that you support folks in the perinatal period. You've kind of touched on volunteering with PSI as a local coordinator, right?
Mm-hmm.
What else are you up to? What else have you done?
Yeah. Well, I love, I should actually mention also the way that I had connected with PSI. It's a funny story.
Oh, okay. We like those.
Yeah. Cause I just feel like everyone, I was just shocked I didn't know about PSI when I was pregnant and didn't hear about PSI and got connected. I think that's the number one point I wanted to share is just everyone needs to know about PSI, especially just the providers who are seeing moms, both pediatricians and OBGYNs. But the provider that I actually did hear about PSI from was my pelvic floor therapist. I've gone after my first baby.
Smart.
Yeah.
Yes.
And she, that was around the time that I just left my job and I knew I wanted to just do something in the mental health space, helping new moms. I was telling her about that. And she said that she was actually part of the local chapter for PSI in Minnesota. And so I was tell me more. And so she had shared more about it. And then I actually did remember, I did hear about PSI. When I was pregnant, it was during a parenting class, but it was really quick. And I only realized and remembered after my pelvic floor physical therapist told me about it. But, during that parenting class, the instructor was talking about, that was the first time I heard the 1 in 5 statistic that the 1 in 5 new moms experience postpartum depression or a mental health disorder. 1 in 10 dads did too. That statistic surprised me even more.
Right.
But she had mentioned PSI as an organization that you can reach out to support that. So I think just to say I'm really grateful that I was joined that community, learn more about the space. I did that work with a life coach just to understand what I wanted to do more. And as part of this, what I was doing is I knew that I actually wanted to have a second baby. And so I think I mentioned in the beginning, like what I used to do for work was do a lot of product launches, and like something I would always do after a launch is make sure I would document what went well, what didn't, like what did you learn and how do you make the next experience better? And so I actually started documenting my first pregnancy and postpartum experience. It's so nerdy.
Nope, we're into it.
That's so cool.
You are in the right place. Got 3 nerds on the podcast today.
Mm-hmm, mm-hmm.
I documented that. I would just like take notes. I was like, what can I do? What did I learn from breastfeeding? Because that was like a big just transformation, learning how to do that. What did I learn from that, from feeding? Just learning how to become a mom, like learn about real self-care and like practicing compassion and being kind to yourself.
Mm-hmm.
But I just started like writing that down. And then at the same time, so I was part of that moms group, and a couple of those moms reached out and they were like, does anyone have tips on how to travel with their baby, like on a flight? And like we had luckily at the time we flew with our baby a couple times before her first baby. And I was like, oh yeah, like I have a couple tips. And I was like, why don't I just like write this up for you? And then just sent her an email, and she like loved it. And so I was like, okay, well, I have this like 50-page Word document, like, maybe I can do something.
I mean, here's the thing. Your documentation was organized in one place, okay? Mine was on like sticky notes and notebooks in 35 different places, right? So
I mean, that's exactly why I did it, because I was like, okay, after the first baby, like you barely have 5 minutes just to like make yourself lunch or like take a shower, like let alone go scrolling through like your YouTube videos or just like the emails where someone told you how to do something that was like brilliant. I was like, I want to have that all in one place, but like a 50-page document is not very helpful either. If like you want to find something like super fast.
You need like a database.
Exactly. I know. But even if you find what you're looking for, you're like, okay, well then how did that work again? It's just like, how did you bring all those pieces together? Like one of my passion projects, like while I took that career break, was just to turn that into just like a website. I really love like photo projects and like web layout, that type of thing. And I really wanted to learn how to create a website. And so just like kind of like put all that information into a website. And so that is something that like I had created just to, again, like be a reference, like a very easy reference for me to go back to. But at a certain point, I was like, okay, there's like something here. I actually added a page with a lot of information on perinatal mental health disorders, because I'm like, new moms and dads or whoever the loved ones are there taking care of the baby just don't understand that it's so much more than baby blues and postpartum depression. There's like a whole range of symptoms or disorders. And so the more people recognize that and understand like, that resonates with them and like what they're going through, the faster they will be in terms of getting and connecting with the support that they need.
Right.
So I was like, I'll put that there. And I was like, okay, well, there's this, this website. I would really love to just share it more broadly. I started sharing that. And the way I shared it was I'm not really active on social media. I actually don't really like social media.
Fair.
Just because for my mental health, I just know that it would like take me like a deep hole of comparison. And it's hard. It's a hard balance because I feel like I miss out on like keeping in touch with people or, learning about like some of these new parenting hacks. But at the same time, I just know myself that I will very quickly compare myself to the mom with like a beautiful home and like feeding her child vegetables and having a full-time job.
There are children that eat vegetables out there.
Sorry, what?
I know. It's just so hard. But I was like, I will use that as a way to just try to get this out there.
Mm-hmm.
Really, like my motivation was to help moms that are out there who might feel really guilty about how hard it is and like how much they can't keep up with everything. Like I just really wanted them to feel, less alone in that process and just really understand that it is hard. And also understand some of these like systemic failures that, our system is just totally built to not help and prepare moms in that journey.
So you did share it on social media.
I did, yeah. Oh yeah, I shared it on. So the one social media I now am active in is LinkedIn, because that's the audience like I really want to reach, especially since it's such a systemic problem, and highlighting all of these gaps in like mental, emotional support, but also just like basic things like paid leave and affordable childcare. Like making sure that all of that is available in each of the states that we live in through our employers. Everyone has a role to play in that. But launched it on LinkedIn, and I was just like overwhelmed by the response. And I think,
what happened?
Oh, so there, it was just within a week. It was just really nice. There were a lot of like very supportive comments. Like in a week, there were just like, I think like 2,000 people that had either commented or like responded or like liked. Yeah.
Wow.
The launch of like this website. And I was just like, which is like great. I think for me, it really opened my eyes to the fact that people like really care about helping new moms and like including moms themselves who have been through there and like been through really hard experiences. Like there were so many moms who'd reached out and told me that they didn't realize until their kids were like 10 or 11 that they had severe postpartum depression, just thought it was normal, just suffered.
It was me.
Same.
I know. It's just, that they had experienced that, like did not have that support, didn't realize that until way after what was happening to them, and just kind of like thanking me for speaking up and just having this website to really help and share with moms and connect them to these resources. And then a bunch of companies too. I think something else I like added in that post was just, if there are any companies that are out there that are helping new moms, would love to connect, and just learned about like 100+ companies that are doing great things to help moms in this space, which is just so encouraging. But I think also showed me that there are so many solutions and resources out there that like new moms just don't know about. I've just learned that there's a lot of like, great solutions out there, but just not connecting to the new moms. Like you said, Danny, like new moms don't even know about them, like that they're there. And then once they do connect with them, just making sure that, they're actually using the solution. So it just, that launch was just so eye-opening for me. I think it encouraged me to continue doing this work and trying to connect moms with like new resources, but also that this is like a topic that people are just really pissed off about. And like really fired up about the fact that our systems are not supporting new moms and being more compassionate about a very, very hard, stressful, and exhausting journey that moms go through, that entire first year after having a baby.
PSI has been saying, hey, the system isn't working so good for like almost 40 years now. I'm rounding up. I think it's like 38. So it's not like we haven't been saying it, right?
But it's still shocking the number of people that don't know about resources.
Yes.
Yeah.
Emily and I included when we became parents for the first time.
Yeah.
We didn't know.
I know. It's great. I think the awareness problem, like I said, the people who are seeing these moms the most are OBGYNs and pediatricians. I feel like education and helping them understand the resources is really helpful. Like after I joined PSI, I remember I had my daughter, I think had her like a 14-month well visit.
Mm-hmm.
I went, I like printed the brochures from like PSI's website. I like wrote a letter. I was like, do you know about PSI? And I was just like I was like a little mini education campaign when I went in.
You walked in as a PSI exhibitor. There is no conference going on, but have I got some information for you?
Exactly. Yeah. Just like trying to, cause they're on like the front line seeing these parents, but I feel for that profession too, because they have like 7 minutes to talk to a patient and like not a lot of time to educate. Another like funny story too, a lot of this is like kind of like embarrassing to admit or maybe not like very ethical, but sometimes, you get the Edinburgh like depression screening during the pediatrician and OBGYN visits.
Yeah.
And a lot of times I actually would like lie on that and I would try, like deliberately score high. Just to see what would happen. Like if I would get a call or like if the like the doctor would actually address it.
Interesting.
And like half the time they did, I actually have to give a shout out. I won't name my like my pediatric or the pediatrician's office name, but they did actually call me and kind of like share some of the support resources, and guess what wasn't on that list for helping new moms who were struggling with anxiety and depression.
PSI.
Hello.
Yeah. And so I always I took that opportunity. I actually I finished letting her just kind of like share. And I was like, have you heard about PSI? And I like told her about it. So yeah, I think that's the number one thing is I think a lot of the frontline providers and medical staff need to know about PSI. Even like these parenting centers, like I'm so like happy that parenting center like talked about, the mental health disorders when everyone's so focused on like childbirth and delivery. the last piece I'll say about this too is I do feel like moms too also have a role to play in this and like sharing how hard their experiences are, because I feel like if you don't share the story to like your managers or, you know, who you work for, to your local government officials, like no one's going to know that there's a problem and it's like where it's not currently working for moms. And so I think sharing your story is just so important to really highlight that, but then also like holding these leaders in our governments and, you know, the provider's offices, healthcare provider offices, and your managers and your employers also accountable for helping you find and connect to that support and just making that support available to you. So I think that that's probably like the other part of the equation of why, you know, new moms don't know too much about PSI or like are connecting with these resources.
We got to share our experiences with each other. That's why we're here.
Yep.
On this podcast, doing the thing. I didn't hear anybody talking about the things I was going through. And it wasn't until I did hear one person that I was like, okay, now my eyes are opened. Oh, okay. So It's not easy for everybody. I'm not a monster. Okay.
Exactly.
And that's why I have to say, I just have to plug your podcast. And I swear Danny and Emily didn't pay me to do this, but I binge listened to the podcast like right before this. The second season, I listened to the first season before we had talked about this. But even I like learned about just like, I love hearing about the real talk and the stories, like both the good and the bad of people's postpartum experiences. But I feel like there's something different to hearing someone share their stories versus like, you know, the PSI website is great, reading the symptoms, but when like you hear someone's story, it like brings it to life. And like,
yes,
you may not resonate or relate to like every single point in their story or their struggle, but like I resonated with like probably a full like 5 minutes of someone's story who had OCD. And I was like, yeah, those are all the things I experienced and like had no idea that that was like an issue that could have been resolved or helped with just like the right support at the time. So you guys are just doing amazing work. I'm
Nancy.
actually going to go back to as like a local coordinator. Like I always send that the list of resources. And I actually want to go back and like write up like a cheat sheet of like every person and like the mental health disorder they went through. And I'm actually going to send and share that podcast episode as like to whoever's dealing with anxiety or depression or whatever they're going through.
We'll connect with you later.
Yeah.
We're going to have to, we're working on that too. Oh my God.
You are? Okay.
Yes.
I love it.
I was like, we need a spreadsheet, like little vectors of like this podcast episode does this, and this and this, you know?
Mm-hmm. Yes.
Because when you're looking for other people like you, other people with an experience like you had, other people that are queer or the same race or had a 4th degree tear, like whatever it is, being able to hear other people that you're like, oh my gosh, it's not just me.
Yeah.
Oh my God. I would love to hear that. I have so many ideas for you guys. We can take this offline, but we
should do that.
Looks like we get to hang out with Nancy again soon. Yes.
Oh my God. I have so many ideas for you guys.
Okay. Well, we better wrap up this episode because we need to go, get nerdy about the podcast.
Yeah.
Anyway,
totally.
I'm just kidding.
So lightning round.
Nancy, are you ready for something fun? The lightning round.
I am.
Okay. Well, let's just jump right into asking the very first question of the lightning round. Nancy, besides this podcast, what is your second favorite podcast? If there is one. I mean,
I do love podcasts. I do love this podcast.
Okay.
All my podcasts these days are really around like parenting. So I really love Good Inside by Dr. Becky.
Dr. Becky. Shout out Dr. Becky.
Oh my God, she's amazing. For those people who don't know her, she's this clinical psychologist based in New York. She's just got like such a different parenting approach where it's not just about consequences and like sticker charts. It's about understanding like behavior underlining the problem or like the tantrum that you're currently going through.
Yeah.
Like I just love how she focuses on building that connection between the parent and the child with like more empathy and understanding and compassion. But I actually think it's so much more than a parenting podcast. Have you guys listened to her podcast?
Yeah.
They're great. I mean, she's interviewed so many like voices and experts in this like self-care empowerment space that like I never heard of before. So like Eve Rodsky, the author of Fair Play, like going back to gender equality, what we were talking about before, like just achieving a fair division in the household and not resenting your husband all the time. Like he was taking me time. Hearing her interview Reshma Sajani, she's another one who's the founder of Moms First. It's a grassroots movement that fights for paid leave, affordable childcare, maternal mental health support. Another one I really love is Emily Obster.
Oh.
Do you guys know her of Parent Data?
Yeah.
The book, her book was Expecting Better, but like that's another thing too, is that there's this American Academy of Pediatrics that releases all these guidelines for babies, including breastfeed for 6 months or, up to 2 years if you can. And then, sleeping in the same room up until the baby's 6 months. And I'm just like, this is great for the baby's health and development and like their immune systems, but like, it means nothing when the mom is just physically and emotionally exhausted and spent and like cannot be there and present for their baby. So I love Emily Oster's work because she really cuts through a lot of the data and, really says like, here's all the data and like what that data is based on, the clinical evidence to show like, how much you should be making the decision off of that versus not. So it was actually, I listened to a lot of that podcast that first year I had after having my first. And it was just, that was actually like my other therapy, probably why I didn't need a therapist that time, just because it like made me feel a lot less alone, like really understand that like mothering is very hard. Mm-hmm. It's not our fault. It's like the system's fault. So I'm just a huge fan of that podcast.
Great rec.
Okay. Are you binge watching or listening to anything real good? Any topic? I've gotten great recommendations for things to watch on Netflix as a result of asking this question. So like, give it to us.
Yeah, I'm not watching anything right now, but I am reading or finished a book that I loved. I've been recommending to everyone. I have it right here. Have you guys read this?
Smart Brevity. Oh,
no.
It's actually also very nerdy, but like a business self-help book.
Oh.
About the power of saying more with less. So I heard about this book, like I would never have picked this up, but my husband started working for this company, Axios. Have you heard of them? They're a modern media company. They like have those newsletters. But their main thing is that, there's just so much content out there. People are bombarded with like all this information. People just have very limited time to consume information. So how do you say more by saying less or writing less? And so like my work right now has been on this website, just writing articles, even just like emails and presentations. It just completely transformed the way that I like write and think. Like some of the tactical tips are just like, write something and then go back and cut half the words. It's like very basic, but like just really important because every word or sentence you shave, give someone 5 minutes of time back in like their lives. It's like just being respectful of whoever you're trying to reach in like the writing and communication.
Yeah.
It's something I'm definitely working on, but like it's a great book to just learn some like specific tips around that.
That's really cool. Okay. What's your best parenting hack? We're here for the hot tips.
I'm always like listening to this in your podcast too, because I'm like learning all the time.
Yeah.
Really important. Added to the website. So mine is actually frozen burritos. So I'm a big fan of meal prepping and bonus points for any recipe that you can freeze for like a future meal. So frozen burritos, like for me, I think like parenting is so much like an endurance sport. Like you're basically up at 5 in the morning, you send the kids out, then you're working for 8 hours and then you pick the kids up and then you're, if you're lucky, get them in bed by 8 p.m. and you go back to work and just wrap up what you're doing.
Or you just try to regulate your nervous system, which also takes quite a bit of time at the end of the day.
I mean, your heart rate is at like 150 for like probably 50% of the day, like with kids and working. So it's like an endurance sport. So just treating it like that. So burritos are a great way. They're like tasty, they're easy to make, protein packed, but I just love that as a way just to fuel. And then like when you're ready to eat lunch, like you just heat it up. It's like super easy.
Like a couple minutes in the microwave and you're good.
Yeah.
Do you have a special recipe that you use?
I do.
Is it on your website?
It is on the website. Yes. Thanks for asking.
Cool. Just asking. I might link that in the show notes.
And I have a bunch of other recipes. Like I do chili, frozen green waffles that you can just heat up for breakfast when you're trying to get kids out the door.
Green?
Like my new thing, if you guys have any hacks, I'd love to hear them. Just hiding vegetables and food, because we have officially entered the picky stage for both of our kids. So doing whatever I can. And actually the recipes they're focused, like they are recipes like the whole family should enjoy, but also like I do it with like kind of an eye towards like, what can you make for the new mom that you know, and like your family or a friend, like what can you make for them that's like will help them with like postpartum recovery and giving them like the energy in that first year. So yeah.
Amazing. You're going to help me meal plan later this week. Thanks.
Oh, I have to say, just last thing about meal planning is like, it's a great time for me time. Like I love podcasts, or like if you like podcasts or audiobooks, it's like such a great way. I used to just redo most of my reading when I would fly, when I'd have like hours of like uninterrupted time. And I like just don't have that time anymore. So
yeah, it's nice, like just walk around the kitchen. If anybody needs you, just kind of point and go, oh, listening to a podcast, I'm making dinner. Sorry, not available.
Exactly. It's so great.
Okay.
Emily, hit it.
This question is one that Danny usually asks, so I'm going to ask it a little differently. What is one way that you will show yourself some totally tubular love today?
You don't like to say radical love. Whatever.
I like radical. Oh, guys, I like radical. Go back to radical.
Oh.
I think any adjective in this way is it like, as long as it's a little extra, it just needs flair. So it could be like radical or like awesome, anything that is sort of a little extra, right?
Yeah.
Totally tubular feels kind of extra. There's alliteration involved,
like
guys. Come on.
I know the alliteration is good. I'm into that. Yeah, I usually try to do the 30 minutes at the beginning of my day, because I know I'm just not going to have time or find excuses not to do it later in the day. Mm-hmm. But these days it comes in the form of I actually used to be like really physically active before having kids. So I know you guys are too. So you can relate, but like I'm just slowly trying to build like my goal is to be able to run long distances again.
Ooh.
So I'm like doing a lot more strength workouts. It's really hard, my least favorite type of like workout, but like I feel like so great, when I finish it, and just like know that like I dedicated that time for myself to do it. So been doing a lot of that, and then doing more of like journaling. That was like something that like I felt like I was like, I can never really get into journaling. Like I just don't really know what to write or say, but it's actually become really like a great, like another form of therapy where you just kind of like practice that self-compassion and just like understand what you're going through, and trying to be kinder and like talking kinder to yourself.
Yeah. Parents, we've got a lot on our minds. It feels actually kind of nice to unpack and just kind of go, you know what? I'm just leaving this on the paper, and like I can come back to it like and do something with it if I need to later or want to. But it kind of feels to me anyway, when I'm doing some writing, like I'm kind of lightening the load a little bit. So good for you.
Oh, yeah. Yeah, it's great. And like you write it down, no one else has to read it. So you can write like whatever you want. And it's just, I think that's the other great part of it too.
Yeah. Cool. This is a question that Emily really likes to ask, and I'm going to ask it totally differently because she has offended me about I'm just kidding. I'm joking.
That's fair.
I know. I kind of wanted to hear how you were going to ask it differently.
I would love for you to tell us if you could say one thing. No, you know what? Emily, can you ask it? This is a you question. I'm like, okay, you go.
Okay. Tell us one thing. If you could hop in a time machine and go back to when things were really, really hard, what is one thing that today you would tell pre-recovery you?
Oh, yeah.
Yeah. I was prepared to answer this question just because I've heard all of the previous podcasts. And I have to say, this is like my favorite question of the podcast. I think if anyone out there is listening, they just need 10 minutes of a podcast. I think listen to this part of the story. I think it's just so great, because I think so many moms are moving so fast that they never take time to like reflect on that like first year and like everything that they did accomplish. Is it okay? Can I just read? I wanted to just like write down what I wrote. Can I read it?
Absolutely.
Okay. So I would say to my younger self, you are built to do hard things. Be kind to yourself when things don't go as planned. All of the hard, the messy moments, that'll teach you more than you've ever imagined. Like when your baby wakes up for the 4th time in the middle of the night, know that you'll be bursting with pride the first time you have to wake him up at 7 a.m. When you go to bed resenting your husband for not doing the dishes again, know that couples counseling will help you feel like a team again. You'll also learn to set boundaries and be more intentional about your me time. When you reach your breaking point and throw a water bottle across the kitchen, know that the next week you'll start therapy and it'll help you heal. It'll help you feel like yourself again, more present, empowered, and kind to yourself. When you're terrified about leaving a stable job without another lined up, know that this break is exactly what you needed to just rest, reconnect with what brings you joy, and clarify your life's purpose to help build a better world for new moms. Every struggle, every hard thing you're going through builds resilience. Instead of fighting the hard moments, accept them. Early motherhood is a season of change, a lot of challenges, and a lot of growth. Celebrate every win, listen to your body, lean on your village, and take care of yourself because you deserve it.
Bam.
Yes.
Nancy, I thought we weren't going to cry today, but here we are.
Yep.
Thank you for sharing that. Oh, those are hard and important things to say. Thank you. Aw.
Yeah, thank you.
I mean, not to change the subject, but I need to get to the hard hitting stuff now. How do you take your water? Bubbles, no bubbles, ice.
Talking about taking care of yourself, hydrating. I mean,
flavor. I mean, honestly, it is a struggle drinking enough water.
That's probably one silver lining that came out of breastfeeding is learning to just hydrate often.
Like a champ, right?
Yeah.
Mm-hmm.
But I take it in a clear water bottle, so I know how much progress I'm making throughout the day, but kind of boring, just flat room temperature, just so I can drink more when I need to. I always have the water bottle on me, just to be able to drink it, because you never know when your kids are going to take you away or work's going to take you away from doing that and taking care of yourself. So,
well, just so you know, that's a very popular answer. There are a lot of people that like room temperature flat water.
Yes.
And it's I think easier on your body too.
Oh, it is. Yeah. I think you can drink it faster. That's good to hear. I actually thought I was alone in that. So
no, you are not, in fact, alone. Nope. Nancy, can you tell us if folks would like to get a hold of you, find you on the internet, how can they do that?
Yeah, you can. So I would love it if you'd visit my website. So I'm at www.nancygoh.kelly. I'm not on Instagram. I'm pretty active on LinkedIn, so you can find me there as well. And yeah, I would love to hear from anyone, working to help help fix the system, or just if you want to talk, get connected to resources. If I don't know the answer, we'd love to help you find someone that does.
Amazing. Emily.
I'm taking us out.
Can you take us out?
Absolutely.
Okay.
Nancy, this episode has been a long time coming, and I think that the journey to get here is the perfect example that parenting makes us pivot over and over and over again. And we still find a way to come back to the things that are important. So thank you for circling back, for making time, because this has been such a lovely conversation.
It's been radical.
Yes.
And tubular and all the things. So thanks for being
love
here.
It. Yeah. And thank you guys for what you're doing. Again, this conversation is so important. I feel like the more moms talk about the good and the bad and this real talk, share their stories, how they've come out the other end is just so important and inspiring and empowering for moms who are just in the thick of it right now. So thank you for what you guys are doing to share that with everyone else. It's just wonderful. And I'm following up with you guys. I have ideas. We have to connect.
Oh, yes.
Take care. Thanks.
Yes. Bye, guys.
Thanks for tuning in to the I Am One podcast. Check out today's show notes where we'll drop links to all the important things that we mentioned in this episode. Please consider sharing about I Am One on social media and following and rating our show wherever it is that you listen to podcasts. It only takes a minute of your time and, well, that'll help our collective mission of bringing resources and local support to folks worldwide. From everyone here at PSI, thanks again for listening.